The dangers of LSD. What is LSD? LSD, or lysergic acid diethylamide, is a hallucinogenic drug that has visual, physical, and auditory effects on a person. It can be consumed either by licking or swallowing the drug. Other names for LSD and how to identify the drug. LSD has many street names, which include acid, blotter acid, dots, mellow yellow, window pane, microdots, bullseye, and big D. LSD also comes in two main forms, which are pills and squares, which are the size of postage stamps. The dangers of LSD. LSD usage carries many risks. These risks include dilation of pupils, confusion and trouble concentrating, headaches, nausea and vomiting, fast or irregular heartbeat, increased body temperature, breathing quickly, facial flushes, sweating, and chills, and death. I'm about to play a video that details the effect that LSD and acid have on the brain.
Affects multiple brain receptors such as the dopamine receptors, adrenergic receptors, and glutamate receptors, but most research is on the stimulatory serotonin receptor 5-HT2A. LSD hits the receptor at an unexpected angle, causing it to fold over the LSD, creating a lid. The LSD is then trapped, which makes this receptor continually fire, causing you to hallucinate. Your body responds by sucking the 5-HT2A receptor into the cell in order to degrade the LSD, but this can take up to 12 plus hours to happen, which is why the high can last so long. Recently, LSD research has seen a revival, and using contemporary neuroimaging techniques, researchers found that the drug causes parts of your brain to communicate in unique ways, especially in the visual cortex, potentially explaining the vivid and complex hallucinations. There's also decreased blood flow in the default mode network, correlating to strong changes in consciousness characterized as ego dissolution, described as a feeling where the boundary that separates you from the rest of the world dissolves. Many people report this feeling brings a sense of reconnection with themselves, others, and the natural world. In fact, a study on 20 healthy volunteers receiving 75 micrograms of LSD saw that 2 weeks after being dosed, they scored higher for the traits of optimism and openness, with increased creativity and imagination. This has led researchers to think about LSD as a therapy for patients with death anxiety and life-threatening illnesses. Researchers found that 12 months after treatment, patients reported a reduction in anxiety and a rise in quality of life as the drug helped them restructure their habits and worldview. It is also why the trend of microdosing is emerging, where a person takes 1/10 of a recreational dose of LSD, attempting to skip the hallucinations and instead experience heightened alertness, energy, and creativity. Although LSD is non-addictive and researchers rate it as significantly less dangerous than other drugs like cocaine and heroin, there's still an extreme lack of scientific studies to explain the widespread microdosing trend, and even experienced hallucinogen users will sometimes experience bad trips, producing irrational fears, paranoia, and panic attacks. LSD can also cause flashbacks, where months after the drug is worn off, it can feel as though you're experiencing the effects of the high all over again. In some extreme occasions, people have developed hallucinogen persisting perception disorder.
As the video shows, although some may argue that there are some small benefits to using LSD, all the potential dangers and risks heavily outweigh any possible benefits or good feelings while using the drug.
Effect-
What can you do to prevent the use of LSD and drugs? You can abstain from LSD and drug use. You can hang out with friends who don't use drugs. You can hang up posters that voice against LSD use, such as the one in the presentation. You can warn others against use of LSD and other drugs. And you can advocate against the use of microdosing due to the risks it presents. Thank you, and here are the sources.